music. AM 1140 WPL.
Stay tuned for Working on Wellness with Dr. Mark Working. Dr. Working has been practicing chiropractic care for 40 years. This show will focus on the latest health and wellness technology, plus review the latest related research. Now, here's Dr. Working.
This is the day the Lord has made. Let us rejoice and be glad in it. Wow. We had a storm last night. Sorry, I'm running a little late today. The storm threw me a curveball. What amount of debris, limbs down, all kinds of things driving here today along the river. And a beautiful day today, but every once in a while we have a little reminder who's in control and that we have to take heed to that. So we are here. We're going to talk continuing on working on wellness and your extremity alternative. I have a lot of people ask me, how do I take care of this conservatively? Extremity conditions. We talked about all kinds of conditions. You know, we talked about carpal tunnel. We've talked about knee conditions, plantar fasciitis. We've talked about tennis elbow, wrist conditions, all kinds of things. But probably one of the things that is so prevalent and very difficult to treat, and there's not a lot of conservative care out there. And when I say conservative care, it is you need, if you're not getting results in what you're doing now, a lot of people think of TMJ syndrome, temporal mandibular joint syndrome, popping in the joint, pain in the joint, other conditions that lead to that, a result of that. They don't know that a specific extremity chiropractor, not all chiropractors, a specific extremity chiropractor, probably through the Gonstead technique, would be one that you would seek to look at this condition. And let's talk about it a little bit. TMJ syndrome basically is an irritation of the jaw bones or articulation up around the temporal area of the head. It's the upper part of the mandible, which, the lower jaw comes up into the upper part and it forms a joint. There's a disc there. It's a certain type of joint that it's called a hinge joint, gluminous joint, and it's very unstable. It's very easily influenced. And, when I talk about extremity injuries, the biggest thing that we see is, of course, it relates back to the spine, a vertebral subluxation, causing an irritation. And when that irritation occurs, that lessens the power, because a normal vertebral subluxation, again, drops the function from 100% down to 40%. That was Dr. Sue's research, University of Colorado, back in the 70s. And that is huge. Not only does it go to joints, but it goes to organs. So different conditions are definitely set up from that scenario. So what happens is that subluxation is usually the upper neck. And of course, that's what chiropractors deal with all the time. That's the basis of their practice. That's the scope of practice. So it weakens the supportive soft tissue mechanism of the TMJ. And because of the cervical ganglia, that's a patch of nerves. It's like a switchboard. It's kind of like a railroad yard where the train comes in and it gets switched off to different areas. That's what a cervical ganglion is. And it's very close to the TMJ. Now I've got my headphones on, but it's right up in this area just in front of the ear, in front of what's called the audio meatus. So, meatus. So, that's the opening of the ear. So when that weakens that allows that jaw to move around a little bit, and rightly so. Otherwise, we couldn't chew, we couldn't talk, we'd have difficulty in those type, mechanisms. So what happens is we get the subluxation, and a lot of TMJ syndrome, all it is an upper cervical subluxation. That's it. So you go into the chiropractor, they detect that, they find it, they adjust that that vertebra back to its normal position. It starts to heal up. The nerve heals up. the condition's resolved. That's simple. Now, if it's been there a while and you have popping, or you've had a traumatic insult into that area, then that could be a different story. You could have actually biomechanic or structural breakdown. So when we have that breakdown, it alters the biomechanics, and there's a disc that condyle, that's the upper part of the jaw, and it goes, and the condyle is a little knob and a little joint surface, and that runs along what's called a disc, similar to some degree of the discs that are in between our vertebrae in our back, but it's only one area that it actually slides on. Well, unfortunately, when that gets out of its normal alignment, it starts to make an abnormal wear pattern. Normally, when there's no stress irritation and you're getting proper nerve supply and blood supply to that disc, there's no degenerative changes. Therefore, you have greater function. You don't have any popping, swelling, pain, irritation. But when that changes, it starts to wear a different pattern into that disc, and it wears what I would call a little groove or a little trench in there, and the condyle has a tendency to track in that particular area. So unfortunately, once it gets out of its normal position, it continues to do that on a regular basis. So it's very important, number one, clear the vertebral subluxation in the neck. Many times that takes care of it. 85 to 89% of the time, that takes care of the TMJ syndrome. But if it's been there long enough and you have that wear and tear to that disc, then we have to change physically the position of the jaw. Now, that's something that needs to be done by an expert. And as I said, not all chiropractors are really trained to do that. And they need to, you need to seek out what I would call a specific extremity chiropractor. They're usually in the Gonstead technique, not all, but most. And I have certified people all over the world in that. And the TMJ is a very delicate joint. More is not better in that aspect. It literally can aggravate the joint or can go beyond its normal capabilities. So we have to know what we're doing specifically. And a little bit goes a long way. So your practitioners that are watching on Facebook Live, you need to make sure that you take heed to this. Because one, never attempt to reposition a TMJ joint without clearing, meaning reducing the vertebral subluxation in the upper cervical area. Never do that. I've learned by experience on that, and so I'm giving you that experience in advance. So we want to make sure we clear the way so the body readily accepts what we're trying to do, because the TMJ has a lot of guarding mechanisms. Now, also because of its position in the upper cervical area and in very close proximity to the cervical ganglia, that network and switchboard of nerves in that area, it can influence a lot of different conditions, and I'll just name a few. One, TMJ syndrome in itself is a very painful, annoying scenario. It can keep you awake at night. You could cause grinding of the teeth. Malocclusal, so it doesn't, your teeth don't come together properly. Bell's palsy, that's a nerve irritation that can cause paralysis to your face. Drooping of the eye, facial muscles, mouth. Trifacial, trigeminal, neuralgia. That is a very painful scenario. And if you've had any of that, hey, Dr. Chuck, good to see you from out there way out west. And my good patient, Jason, hey, I appreciate you guys watching on Facebook Live. And so if you have any TMJ questions, I want our listeners on WVEL to call in, and let me give you the number real quick. 673-1140 or toll free 1-888-673-1011. So if you've got a TMJ syndrome, got a question, don't hesitate to call in, because everybody benefits from the answer. So Those are conditions that can occur. So if somebody has told you you have Bell's palsy and maybe it's not going well, it's a very difficult condition to treat. And it could be as easy as the upper neck cervical subluxation, or it also could be the TMJ, irritation malposition, and causing that irritation. Well, so those conditions are there. They're very significant conditions. And a lot of times, the care that's out there, by putting different apparatuses in your mouth, especially at night, injections, things like that, don't change the vertebral subluxation, which is the beginning and the most important part. They don't change the malposition and the biomechanics to a degree that it stays and it's a corrective major. It doesn't do that. So you need to seek out a specific extremity chiropractor. And I've said that a lot. And the reason why I say that is that I hear all the time, I went to this chiropractor because I was on vacation out in California and I wasn't able to get any help whatsoever. Besides, it was totally different than what you do. So I would suggest that if you're going to check that out wherever you're listening from, or that you're on Facebook Live, is that you may call that office and say, do you do extremities specifically? Are you familiar with the